You must examine a patient every day and make sure that you always include a complete neurological examination. When you finish presenting the history and examination, don't finish with "that's it." You must proceed to give a summary and then a plan. The Year 3 Internet has full details of how to clock a patient. See if you can spot the errors here.
What did you find when you examined the patient?
On examination, his pulse was 84 and regular, and blood pressure 120/70. His heart sounds were normal and chest was clear. There were no masses palpable in the abdomen, and his neurology was grossly normal.
Neurology was grossly what?
He was moving all four limbs.
Anything else?
No, that's it.
What do you mean but that's it? You must always end with a summary and a plan. I also hope you realize that saying that he could move all four limbs is not allowable. You need to tell me about the patient's tone, power, reflexes, coordination and sensation. Have you not seen the neurological examination videos produced by Professor Mirren?
I'm sorry. Although I should have examined a patient every day, I always found an excuse not to examine neurology. I thought that the patients might be a bit tired, but now I realize that I was just being lazy. I should have practiced neurology, especially the ankle reflexes, a lot more in real patients. I have instead examined my friend's neurology.
The problem with examining your friends is that they are nothing like real patients. You really need to practice in real patients with normal and abnormal neurology so that you have some idea of how difficult it can be to elicit reflexes in some people.
Never say neurology was grossly normal or that the patient was moving all four limbs. Always have a summary and a plan of action. Making a plan is the most important thing. If you find that tone is increased on one side, make sure that you realize that the patient has upper motor neuron signs. Reflexes should also be brisk on the same side. Have at least one course of upper motor neuron signs at your fingertips, so that you can come up with a possible diagnosis if you find brisk reflexes. You must always perform Gender 6 maneuver if you are unable to elicit the reflexes.